This is an Andy's Randomness special report. Reporting now, Andy Pollock.
Hello, everyone. Well, let's do this. That way it looks more professional. Let's stand up today. I sit too long lately. Okay. We got to put this down because then it's going to look stupid. That's better. Let's move the chair out of the way for a bit because I'm going to be sitting down anyway for a while. Okay, this is much better. Wow, I actually feel blood flush going through my legs today. Hello, everyone. Welcome to the live stream today. We're going to be hearing from the New York elected officials regarding coronavirus updates. So, as I go along today, we're going to start off with Andrew Cuomo on tape delay. We have Bill de Blasio on tape delay today. I'll also mention today we're doing something very interesting. Maybe I can move the laptop a bit. I don't know if I can, but I'm going to show you guys something. Maybe I can't today, but well. I thought I could. I wish this camera was mobile, but I guess not. Okay. So let's zoom out for a bit. Can we move a little bit? That's better. We'll get the chair out of the way. All right. So I've plugged my Roku into the TV today and into my Elgato capture card. So this is the remote that I like to use for my Roku. I think Roku has a more stable stream for News 12 Long Island than my Amazon Fire Stick does. So I'm going to be using that. I can even transfer things downstairs if I have to for future reference because the Wi-Fi signal works way better down there than up here, which I'm debating if I should even do that. I mean, I could move everything downstairs, even this mic if I have to. But can I get rid of the stand even? Hang on. Make it look more cool, I guess. Looks like I can't. Yeah, see, it's stuck like this. Come on. Okay, well, this will have to do then. Oh, well, I was kind of excited to get it out, make it mobile today, but I guess this will have to do under our circumstances. So, I guess let's just sit down, and I'll show you how this is going to work today. Well, let me even put the mic back like this. But I needed to just stretch. Because let me tell you, folks, it's sitting down all day, it's just not healthy. I'm being completely honest. It's not healthy. So try to at least stretch your legs every day. That's all I'm trying to say. Just stretch your legs every day. Because then you get a little energy, I guess. I don't know how that works. Let me move the cable back a little bit. Just having a little fun today, you know? I mean, we all need that under these circumstances. So, this is how things are going to work today. So, let's say I want to put my computer on. We can even shrink me down. That would be great. Give you a good analogy. Okay? So, this is how things can work. I can use the window capture. Can I even use my mouse? I can get my mouse over here. That would be great. That's better. I mean, you all can get an analogy. So I can do display capture. I can do my camera, which is right here. Video capture device 2, which, by the way, I got to rename this. I really start renaming things. That way I know what I'm doing. And then I can just rename this one, for an example, to Elgato. So, we have that. We have this, when I leave the air. We have window capture, so that way the whole computer screen doesn't get in the way. And then we have window capture. So, if I want to put Elgato on, for an example, we can move this up. And, as you can see here, I use my remote. And as you can see, here is my Roku screen. And at the bottom, I have News 12. So, if, let's say, I get a notification that Laura Curran is speaking, for any example, I can just do that. And then you can hear Laura Curran. So I may have to interrupt Cuomo if Laura Curran does come out, because remember, the New York City stations are not going to cover her. So I want my viewers in Long Island to at least get a fair chance to see the county executive out in Nassau. So, thank you, Joy Jung. Thank you very much. So, right now, what I'm going to do to get everybody in check, we are going to go live to Andrew, well, not live, but can I just see if I can get Andrew Cuomo?
In perspective.
Okay, there might be a way to get him on here.
To take
Here we go. So, this is the tape I'm able to get, so we'll play it from right here. So let me get rid of my camera. And what I'm going to do right now is I'm going to turn the mic off. And you're now going to listen to New York Governor Andrew Cuomo's daily COVID-19 briefing.
take an overall look at where we are, the context, the perspective, because we're starting to see a shift, and I want to make sure that people actually keep the shift in perspective and understand where we are in the scope of our journey through the situation. It's been 18 days since we closed down New York. I know it feels like a lifetime. I tell my daughters every day, it's only 18 days since everything closed down. It's 39 days since the first COVID case in New York. Feels like a lifetime. It's 80 days since we had the first COVID case in the United States. 80 days. Been an intense, life-changing 80 days, but that's what it has been. When we started this situation that we are still in the midst of, before people get complacent, the end of March, the White House task force, coronavirus task force, was still talking about 1.5 to 2.2 million deaths, okay? Their best case scenario with quote-unquote mitigation efforts was 100 to 240,000 deaths in the United States, which is breathtaking. For New York, there are a number of models that were put out that we are following. The most frightening was Columbia University that said we could have 136,000 people in New York City only who would be hospitalized, not infected. We had the McKinsey model, which suggested 110,000 people could be hospitalized statewide. We had a second scenario from McKinsey, which is 55,000 people hospitalized. And then the Gates Foundation, thank you very much, funded the IHME study, which said a high point of 73,000 statewide. Any of these scenarios are devastating for New York, because remember, we only have a 53,000 bed capacity system statewide, 36,000 beds in New York City. So any of these scenarios are problematic. Luckily, the current trend, if it continues, and if we continue the flattening of the curve, we're at about 18,000 people hospitalized right now. We've increased the capacity of the system dramatically. We have moved pieces around the state like never before. Our healthcare system has done a phenomenal job in doing an insurmountable task. Our federal partners, the Army Corps of Engineers, they have just really all done a great, great job. And our theory, and I believe my job as governor, prepare for the worst, hope for the best, but prepare for the worst. Now, we're at about 90,000 bed capacity in our overall system today, with everything we've done. Even the 90,000 beds, as you see, doesn't compare with the most problematic scenarios. 90,000 beds, we can handle the McKinsey moderate scenario. We don't make the McKinsey severe scenario at 110,000. I believe that 90,000, we have a plan to get to 110, converting dormitories, et cetera, but it would be a massive undertaking and a massive scramble. We do make the Gates-funded projection model. The Columbia University model, we can never, that would just be a nightmare. That is the one that keeps me up at nights because you couldn't get anywhere near that projection. But all of the statisticians also said, look, we don't know how effective you can be at closing things down and social distancing because we've never done it before. But they all said that's the chance to so-called flatten the curve if you actually got people to comply with all these measures. And we have never seen it done before in this country, and we don't know if you can do it. So that is the big if in the equation. And that remains the big if in the equation. You can flatten the curve. We are flattening the curve by what we're doing, and we're flattening the curve so far. We should all be concerned, especially New Yorkers. Well, we're flattening the curve. That's good news. It is good news. Well, now I can relax. No, you can't relax. The flattening of the curve last night happened because of what we did yesterday and the day before and the day before that. This is all a direct consequence to our actions. If we stop acting the way we're acting, you will see those numbers go up. And I show the projection models because we can't handle the worst case scenarios. We can't even handle the moderate case scenarios with all we've done. So it is essential that we keep that curve flattened because we don't have an option of handling the curve if it goes higher. The additional good news is the hospitalization rate does suggest that it's coming down, and we are flattening the curve. We had 200 net increase in hospitalizations, which you can see is the lowest number we've had since this nightmare started, actually. Change in ICU admissions is the lowest number we've had since March 19th or so. So all of this data suggests that we are flattening the curve so far, and the numbers are coming down so far. Number of intubations is down. 3-day average on intubations is down. So far, our efforts are working. They're working better than anyone projected they would work. That's because people are complying with them. You know, there are always two questions. Can you enact these policies? And then can you enact the policies in a way that people will follow? We can enact a policy and people thumb their nose to it and continue doing what they're doing. So there has to be a social acceptance and adherence to the policy. And New Yorkers are doing that. They're acting responsibly and diligently, and we are saving lives by what people are doing today. Our expression has been New York tough because every day is tough on many, many levels. I get it. But every day that we are New York tough, we are actually saving lives. And don't underestimate this virus. I think that is a mistake we made from day one. We as the collective we as the global community. This virus is very, very good at what it does. We lost more lives yesterday than we have to date. We understand, and all the experts have said, Dr. Fauci said from day one to me, you will see the deaths increasing after the hospitalizations, because the deaths increase the longer a person is in the hospital, the longer a person is on the ventilator. I understand the scientific concept. I understand the data. But you're talking about 799 lives, the highest number ever. It's gotten to the point, frankly, that we're going to bring in additional funeral directors to deal with the number of people who have passed. If you ever told me that as governor I would have to take these actions, I couldn't even contemplate where we are now. And to put all of this in perspective, I lived through 9/11. 9/11 was supposed to be the darkest day in New York for a generation. We've done everything we can since 9/11 to make sure 9/11 didn't happen again. We lose 2,753 lives on 9/11. We've lost over 7,000 lives to this crisis. That is so shocking and painful and breathtaking. I don't even have the words for it. 9/11 was so devastating, so tragic. And then in many ways, we lose so many more New Yorkers to this silent killer. There was no explosion, but it was a silent explosion that just ripples through society with the same randomness, the same evil that we saw on 9/11. What do? We move forward and we do the work that we need to do. We're going to start an effort called New York Loves, which is going to be a coordination of all the charities and not-for-profits and foundations and people who want to help. There's been a tremendous outpouring of support from organized not-for-profits, et cetera, but also people just wanting to donate, people just wanting to help. The best effort is if we can coordinate all those resources to make sure there's not duplication and we're actually addressing the right need. So the State Department of State, Rosanna Rosato, Secretary of State, and Fran Barrett, who coordinates not-for-profits, we will coordinate all the people who want to donate and help, and we'll work with the local governments that need help. Also, let's learn the lessons of what we're going through now, because we haven't finished going through it. Let's learn how and why this virus kills, especially why we have higher fatality rates among African Americans and Latinos, and what we do about it. Let's understand it, but let's also address it. We're going to be doing more testing in African American and Latino communities with more data. We're going to open new testing sites, primarily in African American and Latino communities, with SUNY Albany, Department of Health, Northwell, collect the test results, but also collect the information that we need to come up with policies to fix this. Where do people live? Where do people work? What's their socioeconomic status? Where do they socialize? What are their previous health conditions? Why do we have these higher rates, and what do we do about it? And let's do that now. Rapid testing and testing is going to be the bridge to the new economy and getting to work and restarting, right? We're not going to go from red to green. We're going to go from red to yellow. Yellow is let the people who can go back to work start going back to work. Well, how do you know who can go back to work? Test them. You have rapid testing capacity. We have to bring it to scale. We have to bring it to scale quickly. And that's something that the state is working on, as well as the federal government. Let's also find a treatment for this disease. Convalescent plasma, which is plasma from people who were infected that can be then used to treat people who get infected. We need that plasma from people who were infected. We're starting a blood drive and asking those who have recovered from the virus to contact us and to donate blood so we can develop the convalescent plasma treatment. And there's a website on the screen that they can go to help. We also have to be prepared and stay prepared. We have to have the supplies, we have to have the right laws, we have to have the right procedures, because remember, the 1918 Spanish flu came in 3 waves. We're on the first wave. Everybody is assuming, well, once we get through this, we're done. I wouldn't be so quick to assume that. This virus has been ahead of us from day one. We've underestimated the enemy, and that is always dangerous, my friends, and we should not do that again. There's an article in the LA Times that says the communities that have dealt with this before, like Wuhan, Singapore, are now seeing a second wave of infection. There is a theory that the virus can change and come back. So this is not, we're in a battle, right? But this is about a war, and we're only on one battle here. Even once we get through this battle, we have to stay prepared for what could come down the road. And we also have to start to repair the immense damage. Before you start talking about restarting the economy, you're going to have to address the damage that is done to society today, which is intense, the economic damage. People who are now living in poverty. I mean, people have been without a check, without a job for weeks. And most people in this state live paycheck to paycheck. And all of a sudden, the paycheck stops. We're doing everything we can on the unemployment benefits and increasing the unemployment benefits, but you have families that are in true economic hardship and are impoverished because of this situation. What we do with the housing market, our healthcare system, we have pushed to the max. We have pushed people to the max. We have pushed facilities to the max. We have beds in lobbies, in conference rooms, in hallways. I mean, we did what we had to do to be ready, but we have done a lot of damage in the midst that has to be undone. So that's something that we're working on immediately. And we need the federal government to be responsible, and we need the federal government to pass legislation that helps. We have to stabilize state and local governments across this country. New York State has had the highest number of cases by far and away. Our costs have been the highest in the country. The past legislation that was enacted, we were told would bring $6 billion to health care. When we did our state budget a couple of weeks ago, we believed what they said, and we thought we were looking at $6 billion in health care funding. Turns out, when we actually read the language, it was about $1.3 billion to the state of New York, which is much different than $5 or $6 billion. And the funding disqualified 1/3 of New York's Medicaid recipients, which nobody said. You know, and to our federal representatives, I spoke to Senator Schumer, I spoke to Senator Gillibrand, this is no time for politics. This is a time to enact the legislation that actually addresses the need. And I was in Washington for 8 years. I get how the political process works in Washington, not here and not now, my friends. We also have a significant mental health issue that comes with what we've done, the isolation, the disorientation. It's a growing problem. We have a growing problem with a number of domestic violence cases. If you need help during this highly stressful period, and I suspect more people need help than acknowledge that they need help, we have a support hotline. We have thousands of people who have volunteered to help, and people should reach out and ask for it. We have to stay ahead of this virus. We're watching Rockland, Nassau, and Suffolk. The numbers have come down in New York City, but you look at the concentric circles around New York City, the natural spread, the natural concentric circles are towards the suburban communities, Westchester, Rockland, Nassau, Suffolk. Westchester, we've had problems already. One of the first hotspots in the nation was New Rochelle in Westchester. Now we're seeing numbers creep up in Rockland, Nassau and Suffolk. The numbers are creeping up, so we're watching those areas next. We sent additional equipment last night. And the overall point is, look, you stay at home and you save a life, period. Stay at home and you save a life. And I know New Yorkers, I'm born and bred. The instinct is, well, this is good news, now I can relax, because by the way, I've been dying to relax and get out of the house and end this Groundhog Day reality. Yeah, you're not out of the woods. And now is not the time to misunderstand what's happening. We have done great things and we have saved lives because we have followed these policies. The moment you stop following the policies, you will go right back and see that number shoot through the roof. And we are not prepared to handle the highest numbers in those projection models. Whatever we do, you can't take a 50,000 bed system and get it to 136,000 beds. It's an impossibility. And I'm a person who never says no and believes New York can do anything if we try. I'm telling you, we have to keep that curve flat. Today we can say that we have lost many of our brothers and sisters, but we haven't lost anyone because they didn't get the right and best health care that they could. The way I sleep at night is I believe that we didn't lose anyone that we could have saved. And that is the only solace when I look at these numbers and look at this pain that's been created. That has to be true. And that has to continue. And that is a function of what each and every one of us does. So, New York tough, yes, we're tough, but tough means we're smart, we're disciplined, we're unified, and we're loving. And if you don't want to stay home for yourself, stay home for someone you love, right? That's what the stay-at-home campaign is all about. You want to have reckless disregard for your life? It's not about your life. It's about the healthcare worker who will have to treat you in the emergency room. It's about the vulnerable person who you infect, who you could kill by your actions. Sometimes it's not about you, right? It's not about me, it's about we, and that's where we are. Questions?
All right, so once again, that was New York Governor Andrew Cuomo giving his daily COVID-19 briefing. Make sure the mic is on. There we go. So, he just wrapped up the Q&A session I was watching on News 12 Long Island, on mute, of course. So, we don't know if Laura Curran will be giving an update in Mineola today. We don't know if Steve Ballone will be giving an update in Hot Pog today. So, those are more questions and answers than we have right now. So, I just have News 12 on mute at the moment. So, we're going to see if we can go to Mayor de Blasio from this morning. Looks like we do have the tape from de Blasio. Let's see where I can fast forward to it. Oh, it begins from right here. Alright, good. Because I was getting concerned I couldn't find de Blasio from this morning. So let's see if I can get it over here. Elmo will be hosting a virtual play date. They're showing it on News 12. I think that is an excellent idea. All right, so we're gonna go to Blasio from this morning. So let's take a listen in. One quick reminder: I will be leaving the air briefly to reset at 1:45 this afternoon. I will be covering live Governor John Carney from Delaware, because Delaware is expected to see 10,000 cases by the end of the month. I am very annoyed that our national media is not sounding the alarm about Delaware, because Delaware is seeing new cases each and every day. They are going near their peak right now. So let me turn my camera off, and we will listen to Bill de Blasio.
Well, good morning, everybody. Yesterday, I talked to you about some of the first signs we were seeing of some progress, of some change. And I want to go deeper into what it means, what we know, what we don't know at this point, but also how we are going to prepare for the weeks and months ahead. Because the fact that we've seen some initial change, we shouldn't overrate it. We should not count our chickens before they're hatched. But it does remind us that if we do everything we need to do as New Yorkers, we can hasten the day when bigger change happens, when we can go even farther. What this all is saying to me, the more our team researches the situation, the more we learn from experience, the more we really understand this horrible disease through actually dealing with it here at the front line of this entire nation. What we're seeing is how much the people matter, how much the future will be determined by all of you, by the people of New York City. What you're doing so far is absolutely on target. It's very, very tough to do social distancing. It's very tough to stay home and practice shelter in place. No one thought it would be easy. I can certainly say, I think for all of us, it's even harder than we imagined. So for everyone who's frustrated, for everyone who's already feeling, cooped up and like it's hard to imagine doing this for a long period of time. From a lot of people, actually, one of the things I hear constantly from people is they feel bored. They feel held back from doing the things they love. Obviously, we all feel deeply disconnected from loved ones that we would normally travel to see, particularly at the holiday season. So there's a deep feeling in this city of the frustration with dealing with all of the changes we've had to go through. And remind everyone, it's only been in a matter of weeks that we've had to make these massive adjustments. So for anyone out there who feels frustrated, who feels confused or angry that all this had to happen, I share that. We all feel it. But we also know that you've been finding a way in an incredibly noble, consistent manner. The people of this city have answered the call. You are practicing social distancing. Is it perfect? No, of course not.
I do apologize, folks. We're just going to have to get rid of window capture and just do this. So,
we're the most densely populated city in the United States of America. We've the worst place in the world to try and achieve social distancing. But people are actually doing it. If you wanted social distancing to be perfect, there are places where people don't live so close together. Maybe that's where it could be perfect. But you know what? It may not be perfect, but New Yorkers are doing it in an amazing way. People really are going out of their way, and you see it all the time, to find new and creative ways to live with the reality of social distancing. Our police officers and all of the public servants who are enforcing this law are doing an outstanding job. Again, is it perfect? No. Are there problems? Yes. And everyone who sees a problem, I remind you, please do everyone a favor. If you see a store that's overcrowded, or you see a line that's close together, not distance each person 6 feet apart, if you see anything where social distancing is not being practiced, call 311 right away, and NYPD or other agencies will come there quickly and make things right. But the fact is, the NYPD, the FDNY, the Buildings Department, the Sheriff's Office, the Parks Department, they've all been out there doing enforcement, and what they're finding time and time again is a very high level of compliance with the rules of social distancing. And they're finding that, yeah, sometimes people need to be reminded, particularly younger people. That's not a shock. Teenagers having to be reminded to follow the rules. For all of us who are parents, that's something we're very, very used to. That's something we did or do every single day in dealing with teenagers. I certainly did, and Shirlane did when we were bringing up our children. So it's not a surprise that all the adults in the lives of our young people have to remind them constantly to follow the rules, and that our enforcement officers go out and see people of any age. They're going to have to remind them, particularly younger people. But what we're finding is when the police show up, or any of the other agencies, the reminder is working. The warning is working. We're not in a situation where we have to give a huge number of fines. But we do need people to call 311 the second you see it. Anyone who's frustrated, angry, or they see a lack of social distancing, or they see people crowding, you know what? Don't be angry. Just pick up the phone. Well, you can still be angry, but the most important thing is don't be angry and hold it into yourself. Act on it. If you really believe it's a problem and you don't make that call, then I have to say, I guess you don't think it's that much of a problem. So seriously, all it takes is a call to 311, and then help will be sent immediately. This is the highest priority for the NYPD and all the enforcement agencies to get this right. But I say that to a point. Generally speaking, people have actually been following these rules. Folks have been staying home. They understand you go out, you do just what you need to do. You get food, you get medicine, get a little exercise, get back. People have been doing that. I've been in many places in the city, and you feel like it's a ghost town. People have been following the rules, and that's why we're starting to see some improvement. And we are far from out of the woods, but we're seeing something because you did that. You earned that. And I want people to think about it this way. We, all of us, 8.6 million of us, have to earn our way out of this horrible situation. Do we deserve what we've gotten? Of course not. No one ever heard of this disease 6 months ago. It didn't even exist. And yet it's visited upon us in a way that's the worst in our nation, one of the worst experiences in the world. But that, when I say we need to earn our way out of it, it's not because we did anything wrong. It's actually because we're doing everything right. New Yorkers are answering the call. But we need to understand we have to save ourselves here. There's clearly a lot more our federal government could be doing, and I'm going to talk about that, particularly when it comes to testing. But we have to fight back this virus, and we have the power to do it in many, many ways. And if we do it the way we're capable of as New Yorkers, the toughest, strongest, most resilient people in this nation, we actually can push this virus back. We actually can overcome this phase we're in. And I'm going to show you what that means. I'm going to lay it out today. And we actually can get to a point where we start the pathway back to normalcy. And it will not be easy. It won't be like a nice straight line. I want to warn you right now. It's not like we're going to,
Hang on, folks. I'm getting word that Laura Curran is about to speak in Nassau County. So let me put the Elgato on in just a second. I'm waiting. Let me put my camera back on. That's better. Okay. We're waiting right now for Laura Curran to come on. I don't know what News 12 Long Island's doing right now. They're airing some sort of weird infomercial about exterminating. But, I just got the notification on News 12. We are going to break in from Bill de Blasio. We're going to go to Laura Curran in just a second. Okay, folks. Yeah, Laura Curran is about to come on. Here we go. So let's listen in.
Pest control has been deemed an essential service statewide, so open, answering our phones, and we're all working.
We are following every sanitation and safety measure from the CDC and beyond.
We'll get through this together.
News 12.
What is going on with this today?
50. That was actually
Do apologize, folks.
4. We had discharged yesterday 232 COVID patients. So that's the 4th day in a row that we're seeing the number of dismissals, of discharges, much larger than the number of new cases coming in. In fact, we've had a decrease of patients coming in. We still have 455 patients in our hospitals on ventilators, and that's an increase of 6 from the day before. As of last night, according to the state, we have 566 of our residents who have passed away of COVID-19 of our residents. I know the press is reporting in some places 701 fatalities, but if you look on the tractor, that 701 number is fatalities that have happened in Nassau County. I'm looking at the number of residents in Nassau County who have died. We know that we have residents from other counties passing away in our hospitals of COVID. So I'm watching very closely the number of those who have passed away. And that's 566 according to the state as of last night. We know that our elderly are most vulnerable to succumbing to COVID-19. We also know that our nursing homes are being hit hard, island-wide, countrywide. It's very sad. We've been seeing the numbers of A. Holly Patterson Nursing Home, 17 fatalities, many more positive. It is heartbreaking to think of our seniors passing away without their family around them by their side. We're also awaiting from New York State the racial breakdown, county by county, of those who are passing away of fatalities. We're told that it's coming soon, so please be ready for that. We also know that we have health disparities along racial lines in our county and in our country. We know in Nassau County, African Americans have a higher rate of hypertension, higher rate of diabetes, which are the 2 largest underlying factors in complications of COVID-19 and in complications and also death, unfortunately. So going through some more numbers, our police department, this is all of our police departments in the county, 124 total positives. 185 currently in quarantine, and 126 cleared and back to work. Sheriff's Department, so that's corrections and deputy sheriffs, 42 positive, 75 in quarantine, 25 cleared. We've had 1 who was cleared who is symptomatic and is now back in quarantine. Inmates at the jail, currently at 20 positive in isolation, and then 5 pending, also in separate isolation. The status of our probation workers and our fire marshals is the same as it was yesterday. Give a special thanks to our medics who continue to work incredibly hard under difficult circumstances. We still have our FEMA ambulances here, 10 FEMA ambulances. Each came staffed with 2. They're on split shifts to give our medics some relief, so we're very grateful for the help. We also want to thank our volunteer EMTs. I just want to give you, one example of the people that we're losing is one of those volunteer EMTs. His name was Mike Field, 59 years old, Valley Stream Fire Department. So he volunteers in Valley Stream both as a firefighter and an EMT. He was an EMT for the FDNY for more than 20 years. He was at Ground Zero, working there. True hero and a true loss, and we're with his 3 sons and his wife and the Valley Stream community. He was very deeply involved with the community in many ways, and so we're with you and we mourn with you, and we mourn with every family and every community that's lost loved ones to this virus. We also lost, I'm sorry to say, 4 CSEA members to COVID-19, 3 at NUMC, Nassau University Medical Center, 2 rehabilitation counselors, and 1 lab technician, and a 4th member at A. Holly Patterson, a nurse's aide. All 4 had underlying health conditions. And you see the importance and the fact that these underlying health conditions really do make these fatalities such a much larger number, really much larger than we can bear. How are we doing on supplies? This is something we are tracking through our Office of Emergency Management. Hospital executives are telling us now there is an urgent need for gowns, for those disposable paper gowns that medical professionals wear. So far, our donation drive has reaped thousands upon thousands of boxes of gloves, N95 and surgical masks, wipes, face shields, goggles, hoods, shoe covers. Businessman extraordinaire Jim Hagedorn has flown out to us immediately $110,000 worth of face shields for our first responders. So a huge thanks to Jim Hagedorn for that. Henry Schein has distributed more than 35,000 N95 masks. So that's from FEMA through Henry Schein. Thank you again. We're seeing, as I've said before, ingenuity, all hands on decks. Our public libraries are using 3D printers to create face shields, and they're also using them to create components to turn BiPAP machines into ventilators. The Pakistani community of Long Island and the Islamic Center of Long Island is donating food today and tomorrow to our first responders, so thank you. Our school community has really stepped up. Great Neck School District, Garden City School District, New Hyde Park, Garden City Park School District, Locust Valley School District, Plain Edge School District have all stepped up for donations to help us disinfect equipment and supplies for our first responders. So thank you. I know my home school district of Baldwin has also donated whatever PPEs they have to the donation drive, as have other school districts. So we are so grateful for all of your help. Please keep it coming. You know, we appear to be in a plateau at this moment, but that plateau is at a very high crisis point. It's not like it's just coasting now. This is serious crisis mode for a consistent number of days, so we continue to need your help. And I just want to reiterate, the urgent need right now, today, as I am speaking to you, is gowns, those hospital gowns. I'm told the supply chain is drying up. A lot of the factories overseas that were making them have switched their production over to masks.
I do want to apologize for that went out on me. I want to make sure that we are still live right now. Okay.
Of some progress, of some change